Good morning and welcome to our launch event for the Strategic Collaborative Planning and Commissioning Guide. I'm Peter Wade, Senior Programme Manager from the Better Care Fund team, and standing in today for Simon Williams, who unfortunately is unable to join. We've got a very good agenda lined up, and I'm delighted to be joined by members of the IPC team who led on the development of the guide, which I'm sure a number of you will already be familiar with. It's already being published, as well as two local system stakeholders who are from two of the five systems who are central to the guide in terms of the case studies that really help to bring that guide to life. So we're delighted to welcome them as well. My colleague Phil from IPC will be doing the introductions, but just in terms of the format for today's event, it's essentially there are two main parts, because Phil is going to lead on talking about the guide itself and the background to that, as well as Amy and Jonathan in terms of the key enablers, and then we're going to hear from, as I say, two local system stakeholders who have been involved from the local system perspective in terms of the case study of development and bringing the key principles and so forth within the guide to life and operationalising those as well. In terms of questions, if those attending the webinar could please hold on to questions and post those via the Q&A function, and we're going to get to those towards the end of the session to give maximum amount of time, particularly to hear from our local system leads, and we'll get to whatever questions that time allows within the hour. We will aim to finish dead on 12. Any issues from a technical perspective, as is outlined on this slide, please contact Fiona Wildman, and be delighted to have any feedback following on from the event as well in terms of the evaluation forms, so do feel free to use that. So we're delighted, as I say, to be able to launch this important output. We really are very hopeful that systems will find this useful, because it has a very strong practical focus rather than it just being a piece of guidance. So hopefully that's one of the main emphases of today's session, and I think bring it to life through the case studies, I think is a key ingredient to enable that to happen. So just in the interest of time, I'm going to hand over to Philip from IPC, and he's going to also introduce colleagues to talk about the guide itself. Many thanks.
Thank you, Peter. Good morning, everyone. My name is Philip Provenzano. I'm Assistant Director at the Institute of Public Care, and I'm really pleased to be joined by not only colleagues from LGA and the Better Care Fund, but colleagues from IPC, Amy Harmsworth and Jonathan Gardam, who are really key to working with those colleagues that we have from Nottinghamshire, Nottingham system and the Somerset system and others to put this guide together. So a big thank you to everybody and those who joined us on the various engagement activities over the last 10 months or so. Really pleased with their contribution, and hopefully what, as Peter said, is what we prepared is a guide with some top tips, some practical examples, and some real examples about this the collaborative approach, of promoting a collaborative approach to planning and commissioning on a strategic level. And so the document is aimed at strategic leaders. So it's already been published, so hopefully you've had a chance to have a look at it. So what we're going to do the next less than an hour is to just say a little bit about what the content of that guide is, and pause a little bit on some enablers that we think are fundamental to this particular approach. And as Peter said, I'm really pleased to be joined by Naomi Robinson from Nottingham and Nottinghamshire system, and Joe Coughlin from the Somerset County Council. So we'll get to them as soon as we can, and you'll have an opportunity for questions and answers hopefully towards the end. Amy, next slide. So those of you who don't know us, we're part of Oxford Brookes University. We've been around for some time, about 35 years. We're a not-for-profit organisation, and as you can see there, we do work across the UK with a whole range of organisers across health, social care, so adults and children's, etc. Next slide. And if you haven't done our work before, here's a little plug. We do evaluation, training and consultancy, but we've had a good working relationship with LGA over the last couple of years, and hopefully you find this document a useful document. Next slide. So this was the ask. We had a big conversation with colleagues from the LGA last year. It took us a while to kind of bring those activities to the fore, but that was the task. That was the ask. A guide, co-produce as best we can over a relatively short period of time to aim at strategic leaders across health and social care, a document that's going to describe, explore what works and what's going to be helpful as we moved into ICSs, ICBs, ICPs in April to progress that collaborative commissioning approach. And so hopefully the document has that within it, but also offers a whole range of other examples. There's 5 case studies in there that you find were useful and no doubt will be a source for you to maybe contact, but certainly share within your own systems. Next slide, please. So a brief overview. As I said, we didn't start with a blank page. We had the integrated commissioning for outcomes document, which the LGA prepared a number of years ago. We asked people what this document needed to be, what the new document needed to be, what would be useful. And we did that through a number of expert roundtables. We engaged 3 specific systems. In addition to Nottinghamshire and Somerset, we also spoke to the Greater Manchester system. And then we brought on board 2 further systems to supplement the case studies. We sent out some questionnaires and hopefully that reality, that real work on the ground is illustrated in this document. Slide. So the guide hopefully is as I said for strategic leaders in health and social care, and hopefully people can use it as and providers, both independent sector and voluntary sector providers can use it as a lens in which to reflect their own experience, their own practice. And whilst we haven't included a self-assessment, we think there's enough there for people to say, yeah, that's really helpful for us to pursue that or take note of that and to reflect on local arrangements. Next slide. Okay, so the document is in 2 parts. This first part is a little bit about context and why, and I kind of already alluded to the time frame in which it was prepared. But we thought it'd be useful just to have some terminology, our description of what we mean by strategic collaborative commission, what we mean by good relationships, etc. So I won't go through that, but hopefully that sets the scene. It sets the context for the why and the elements that good, effective planning and commissioning at strategic level, those component parts, we think is useful just to have a spotlight on those key areas, and also its intended outcomes. So here's an example of what we were trying to do through the development of this document is focus on outcomes at a strategic, a place level, and an individual level, so I mean a population level. And it's almost to explore, well, okay, how can we collaborate? How can systems collaborate to meet those outcomes? Looking at the range of support, services, as I said, across a whole range of providers, both at a universal level, going through to a preventative level and a targeted, maybe more hospital-based, as you can see some of those areas there, and say, well, how can we collaborate across that system? Where's the connectivity? How can we do better in the planning and allocation of resources, etc., to maybe move a little bit more towards the left-hand side of that diagram in terms of more of a preventative approach? So that was really the ask. Can systems do that? How can systems do that collaboratively? Focusing on outcomes, obviously, and you can see this is just an extract of some of the outcomes that we have in the document. The I statements, again, we lent very heavily on the TLAP work, and hopefully you'll see the similarities in there. But those population and place we statements, we hope that we would be commitments that systems would look at and go, yes, what arrangements can we put in place in order to either a population level or a place level. And I hope that you find those helpful, almost to, as I said, as a lens to talk those through. Next slide. So part 2 has these 4 enablers, and there was kind of an iterative process in establishing these 4. Part was what we've already seen systems undertaking and what's been written before, but then it's what emerged from the conversations that we were having with the 3 systems and the case studies. There were some common factors that were emerging that people said, yeah, you know, our relationships are important. Okay, let's have that as a key one. Let's try to understand that. The way that we co-produce, not only with users of services and populations, but also with providers. How do we share those risks and share the benefits? So something around the information and performance there is something that they merge. And finally, creative use and allocation of resources, not just financial, but human resources. And you'll see some other examples. So there were the 4 areas that we think actually this will be useful for us to explore a bit further. Final slide from me. So you'll see in the document, each of those enabler sections has a description, has a number of principles, and we'll give you a little bit more. Jonathan and Amy will just share these in a bit more detail in a moment. So it has the principles, has the case study illustrations, and top tips. I mean, it's hopefully you find that phrase useful to draw your attention to, again, drawn from some of those systems about what they've undertaken. We think it's probably worth repeating those as top tips. So that's it in a nutshell in terms of the document. Hopefully you find it accessible and useful as you go through. And there's a reminder of the five case studies. So again, thanks to colleagues in Gloucestershire and Hampshire who are not joining us today for their contribution. And you'll hear a bit more from Joe and Naomi later on. So that's the document. Okay, hand over to Amy.
Thanks very much, Philip. Okay, so Jonathan and I are now just going to go through each of those 4 enablers in a little bit more detail, just demonstrating and illustrating the principles and the top tips that sit underneath them for you. So first of all, the first key enabler that Philip described there was strategic collaborative relationships. And it's not by mistake that this is the first key enabler that we added to the guide. We heard very strongly from the colleagues that we worked with that supported us to put this together that achieving those robust and transparent and trusting relationships between colleagues within the health and care systems, etc., is paramount. And without this stage being achieved, all the other key enablers and principles around it will suffer, really. And this was quite clear that this seemed to be one of the most important, although they're all important and they're all needed to be in place to be successful with collaborative planning and commissioning. This was very clear that this was sort of stage number 1 and helped with that real foundation of key collaborative commissioning and successful collaborative planning and commissioning. So these are some of the principles that we came up with around that. So, you know, I'm not going to go through all of them with you. You'll be able to see these slides, and also it's in the document as well. But it's very clear around ensuring that colleagues trust each other to perform and make decisions on their behalf, having shared visions, joint decision-making processes, and also even agreeing how, you know, if disagreements do come along, how will we resolve these in the most effective way. So really, really clear about how do we get this kind of big culture change. And I think one of the key messages we heard is around having those right people in the right roles to drive this forward and ensuring that the time and the resource that is needed to get this right is in place. And that's reflected very much within the top tips that came out of the case studies and the colleagues we spoke to within the system. So these are the 6 top tips that we came up with for this first enabler. And as you can see, you know, it's very clear about we need to be honest and transparent and have clear communication channels and listen to each other. And, you know, I quite like that right time, right place, right people. It feels very sort of echoing of what we talk about when we're talking about delivering to our local people as well. But I think it's really key that that's the role we take, and that's the vision we have for driving this forward as well, having like-minded colleagues who have ambitions to get this right and are willing to work together and innovate and do things differently as well. The taking the time to get it right, as I said, it's really important. And actually the colleagues that we spoke to across the country about, you know, how long it actually takes to really get mature, effective relationships and systems up in place and everything working can actually take at least 24 months, you know. So it's really important that we don't think this is going to happen overnight, and we don't lose, you know, our willingness to get this, because it's not happening really quickly. So that's really quite important to think about. We heard a lot that, you know, the COVID-19 pandemic, for good and for bad, you know, meant that we sort of dissolved a lot of sort of organisational boundaries, and we were able to work together a lot more effectively, maybe because, you know, new funding arrangements were put in place, but also, you know, we were all dealing with quite a significant crisis that we weren't expecting and never dealt with before at that level. But actually there's some learning from that COVID-19 pandemic. How did, you know, we broke down those barriers. How can we make sure we keep working in that way to be as effective as possible for lots of different interventions and support that we offer across our services? That removing any of them, you know, we're one team, we work together. That was quite important in terms of a culture shift. And then finally, just around ensuring that we have a sense of parity between all partners and that we all bring added value to our strategic relationship. The second key enabler was all around co-production of support and interventions. So, you know, we know that this is quite important. You know, co-production not only sorts across ourselves as organisations, maybe between health and care, health and local authority, health and housing, health and police, whatever it might be, but also, you know, to go further in that and include meaningful relationships and partnerships with individuals with lived experience, local communities, the VCSE organisation, and providers of care as well, to ensure that we're working together to get this right. And again, some of the principles here really focus on seeing co-production exactly as co-production should be seen. People are equal partners. They have an equal place around the table to influence and drive decision making around some of the changes or the priorities that might be happening in their local area for the support that's available to them. And we consider the variety of options of how we get there in the first place. That was really important within collaborative commissioning as well. And the top tips we came up, we heard from our colleagues were these ones here. So acknowledging that we don't have it right. It's not always easy, of course, to do that. But, you know, within a partnership, we need to be quite honest with our local people when maybe things aren't quite working, and what do we need to do or change to make it better. Making it formal, making that co-production approach a formal approach, maybe through policies or procedures, and just ensuring that that does have a formal place within our governance framework to recognise the importance of involving all partners in the decisions that we make. We heard quite strongly, actually, in one particular case study in Nottingham, actually, who we'll hear from later, that, you know, hearing that anecdotal evidence actually is really powerful and can really support adding extra context to, you know, what people are experiencing and going through. So it's really important to add that in, as well as mixing that and combining that with your evidence that you've got as well. And then finally, it's all about knowing your local area. You know, are you engaging with every element of all the assets that are out there in your local community who contribute and support people? So really doing a lot of mapping work to understand what is the offer that's out there, not only by services or interventions that we commission ourselves, but actually some of the other things that are out there that contribute to that preventative model, contribute to people's well-being, and therefore can help us think about priorities and how we work together going forwards. So those are the first two enablers. I'm going to hand over to Jonathan now, who's going to talk through the second two.
Thank you, Amy. So the third one we're talking about, the third key enabler, which is part of the series, is around the sharing of risk and achievement. And you know, it's important to recognise the two sides of the coin here. You know, this is not just about, you know, difficult relationships or how you overcome some of those things, but also celebrating the success within those collaborative partnerships. So again, we set out a number of kind of key principles that underpin this. And you know, we see as key enablers as around, not just around kind of pragmatic steps that you can take around sharing outcome frameworks and developing risk assessments jointly and things like that, but it's also that cultural approach about how do you kind of communicate with each other, trust each other. Kind of builds on that strategic relationship element, but very much around focusing around how do we work collaboratively around the challenges and opportunities that are being faced by systems, you know, now and going forward. So we talk a lot around things like working hard around you know, developing joint risks approaches, you know, to mitigate some of those risks, signing up to kind of joint approaches, having very broad collaborative conversations. So these are kind of key principles that underpin some of those things. So in terms of the top tips, if we move to the next slide. So we pulled out 5 what we think are kind of top tips for systems, and one of the important things is around governance. We talked a lot of systems that had joint posts, tried to do things in a singular way. And you know, when we talked to places like Manchester, they had kind of a joint team that oversaw different partnerships, and we saw that's quite important to minimise burden, but also allow for decisions to be made more collaboratively. Having robust conversations, you know, that's really important, that people have confidence and to be able to kind of express things and talk about things in a very open way, and yeah, that's an important element around how people work collaboratively together. Investing in for the long term, you know, this, you know, collaborative approaches is a kind of long-term journey, and you know, we're talking about in terms of kind of how people work together, that they look for that long-term vision about making that investment into the systems and how people are working. Number 4 is about uniting around shared visions, around shared outcomes and objectives. You know, systems, now we have your integrated care strategies. That's a place where you can bring things together, not just at a local level or in a locality level, but across the system as well. So, you know, that's very clearly a key part of that discussion and arrangements. And the 5th one is really kind of, again, working together, but this is around building risk assessments and frameworks together. So you can share those risks and you can share the responses to some of those risks that are impacting upon the systems that you're working within. So yeah, that's our kind of view around this key enabler. And then the 4th key enabler is all to do with the money, but it's not just the money, it's about capacity and about how systems are sharing that capacity across themselves. So it's, you know, as we're moving into potentially another austerity period, this becomes even more relevant and important about how systems are working together. And again, the important dimension here is about being creative. You know, the pandemic offered opportunities for systems to be more creative about how they use that resource going forward. And very much when we talk to systems, they felt that the legacy of that was really important. But how do they sustain that creative approach to using resources in a more open way, rather than retrenching back into systems and organisation boundaries? It's about having a much more collaborative approach to those resources. And as I said before, it's not just about the money, it's also about how you use your capacity, your human resources, your intelligence and data. So it's all those elements that we came out very strongly through talking to the systems. So in terms of top tips, again, we pulled out 6 top tips here for you as a stimulus for discussion. Flexibility, you know, keep focused on the destination, but have flexibility, be creative around how you're using your resources. Good one here about keeping it simple, you know, and straightforward. You know, we need to kind of remove the linger bit here, and the systems kind of coercing around or kind of gathering around the same vision, the same outcomes, and working collaboratively together around that vision. We had lots of examples here about creating joint posts and joint budgets, not just through Section 75 agreements, but also, how do you bring those resources together in a creative way? Coaching rather than instructing. So this is about having that kind of collaborative approach to how we respond to situations. Put agreements in writing. When we talked to one of our systems, they talked about having a memorandum of understanding, setting out on paper how you're going to share those resources, how are you going to make that commitment going forward over the long term, who picks up which part of the investment and the risk as well. So having things in writing we feel is an important dimension to allow systems to work better together. And the other thing is about left and right hand, bringing financial directors and leads together. This is not just about operational relationships. It's also about looking corporately, but also looking with your financial directors to work collaboratively. So they're the kind of things that we feel kind of jump out from our discussions, and we hope that that's helpful in terms of as you take these kind of discussions forward. Now, I'm really happy now to pass on to Naomi, who will now talk about the experience in Nottinghamshire. Thank you.
Thank you. Hi everyone, so my name is Naomi Robinson. I'm a Senior Joint Commissioning Manager. I'm presenting on behalf of the Nottingham and Nottinghamshire Integrated Care System about our approach to commissioning collaboratively a sexual violence support service. So our approach is a co-production story, which started in the context of a very raw response to the publication of the independent inquiry into child sexual abuse, which investigated the extent to which local institutions had failed children placed in residential or foster care locally. So there was very senior buy-in to take a co-production approach from the beginning. We had to think about repairing and building trust with survivors, and we, through our approach, were continually readdressing the power imbalances that survivors had felt the impact of for a very long time. So that's senior leadership across commissioning organisations, but particularly the Police Crime Commissioner. And as a result, that co-production for the service that we now have was quite transformational. So it brought everybody together. It built a service that feels owned by the survivors, and that approach has spilled over into how commissioners worked. So it brought everyone together, the Police Crime Commissioner, both local authorities and health. And our first step was to jointly assess the level of need and how well our existing services were meeting that need. So this included lots of conversation with survivors about their experience of seeking support, and also how their experience of sexual abuse is impacting the way they access a range of services now. So across the totality of the commissioning timeframe we spent, we have the largest period of time spent reviewing our current service offers and really understanding why services weren't willing to work together to meet the needs of survivors. The needs assessment found that we had insufficient specialist support, and this included our mental health offer, and it also found that we had fragmented offers of advice and support across our system. So the next slide, thank you. So the idea of a single specialist hub approach came from survivors. The emotional journey to undertake therapy is very complex, and the guiding principle that we took forward was to create a simple and coordinated service that's able to flex to individual preferences. In January 2021, we were able to launch our newly jointly funded specialist sexual violence support service across Nottingham and Nottinghamshire. So this service enables survivors to access a broad range of support from one place, organised around their needs. The offer includes advice, information, one-to-one and group counselling, psychotherapy and other specialist treatment. It's also important, and it's delivered seamlessly with the Sexual Assault Referral Centre and also into our more specialist mental health offers. The service supports over 800 individuals a year now. Outcomes are reported using a clinical score, the Core 10, with approximately 85% of service users reporting an improvement in their outcomes. And we found this to be much higher than similar therapy services treating a similar level of complexity. Next slide, please. Thank you. So I thought this slide would be helpful. So our approach locally can illustrate some of the key enablers in the collaborative commissioning toolkit. So as I said, co-production was crucial. So we worked with the people we were aiming to help, and there was very senior buy-in from the beginning, and this was visible in co-production forums. That energy is now continued through service delivery, so it's embedded in how the provider works with service users. Things like they've been working together to co-design the new SARC Sexual Assault Referral Centre building, but also things like approach to managing waiting lists. So how do survivors how would they like to be best supported whilst they're waiting for their therapy to start? What offers could be put in place? Do we want to explore things like peer support? And those conversations are happening with the service users themselves. So in terms of collaborative strategic relationships, this is very important. And as I said, I think the co-production approach spilled over into creating this very much. So we had a shared vision, clear governance. So as I said, it was very senior management, which was probably very appropriate for the pace and risk around the area of commissioning. But what that also helped us with is we very quickly had that line of sight into clear governance across the system. So we weren't kind of, as we were going along, trying to battle for that kind of joint senior sign off to things. It was there from the beginning. We did a lot of work, not just in the co-production with service users, but with our fellow commissioners across agencies to build trust and parity. So I spoke around the kind of power imbalance with survivors, but it's more subtle, I think, when you're working across commissioning organisations, and there are subtle power imbalances, and that can be things like using different language or thinking you're using the same language, but actually it's different. So we spent a lot of time working together on mental health terminology, exploring what different agencies meant by mental health crisis. And I think that kind of that work together helped us to explore existing services, but also have that same page approach to the language we were using and not misinterpret the assessment of our existing provision. So collaborative sharing of risks and successes. I think from the beginning there was this shared appetite for innovation and a willingness to test a new way of working. So we were committed to delivering a service that felt different to our mainstream services that really responded to the needs of survivors. And I think that there is an element of that was a success and risk. So we wanted to take a personalised commissioning approach, or to test it, and the survivors said that they wanted to have that option. And one of the processes, for example, that we tried was a individual funding request process. We thought that we would be able to do that through our existing system assessment process, but we quite quickly learned that process wasn't fit for the needs of survivors. It was probably something in that assessment process itself that didn't work for survivors. So we worked together on listening to what survivors were telling us about how well that process wasn't working, but we stayed committed to the idea of a personalised commissioning approach as an option for people. And then we're now exploring personal health budgets, so kind of not with a slightly different assessment process. We've also worked together on committing to a mental health registered mental health nurse post. So that post is employed by our mental health trust and seconded into our specialist counselling, our sexual violence hub, and that post is working really well as a bridging post. In terms of kind of that collaborative sharing of success and risk, all commissioner partners attend contract review meetings. So but it's not as an assurance, or that we have we're kind of lacking that trust to delegate to a lead commissioner, but it's more of to keep that collaborative co-production with the provider going over the life of the contract. So we're addressing issues together, and I think it's kept the collaborative energy through the beginning of the service, and now kind of, I guess, to the middle stage and into how do we develop this service for the longer term. So I think that's important. So we don't there's a lot of people in the contract review meetings, but it's not that typical provider commissioner relationship anymore. It's much more collaborative. In terms of the allocation of resources, we do have an agreement to pool resource. We as a system, we recognise the need to invest outside of our existing pathways, and I think that speaks back to that needs assessment we did jointly. And we took a straightforward approach to the funding split. So it is just a straightforward fair share across commissioning agencies. I think we wanted to avoid protracted discussion around individual commissioner responsibility and service areas, and I think that was because we wanted to maintain that commitment to a single service offer to avoid funding splits impacting silo working within that offer. It's working well, really well now. We've got over that hurdle of who puts what money in. Next slide, please. So I think the collaborative approach that we've taken to commissioning and that ethos of co-production means we have a positive foundation for our future joint work. So I think about 18 months into delivery, it still feels like a partnership between the different commissioners, but also the provider and the service users. And we are exploring issues and service level issues together. There's the same workforce issues around recruiting counselling staff and mental health staff impact this service that impact our mainstream services. So we're trying to have those conversations as a system pressure so that, you know, our specialist service isn't feeling isolated in that conversation with commissioners. And I've spoken about the mental health nurse. It's kind of our bridging role into adult mental health services. That service is really working well to manage our more complex service users, so the people who need more support to stabilise their mental health before they're able to access more specialist kind of trauma type mental health services. And the learning from how that role is working, that kind of almost triage complex service user oversight, is being embedded into our long-term plan mental health transformation programme. So all the learning from this specialist service is being poured into there, because there's wider learning about other people with complexity and risk. And then just to say that finally, sorry, I also mentioned that I think our collaborative commissioning relationship has meant that we've been able to respond very quickly to the recent NHS England opportunity for increased funding to that mental health support for our most complex survivors, and as part of that we're including a role that's a kind of strategic pathway development role to support that longer term sustainable pathway development for this specialist counselling and how it fits with our core mental health services. And then just to say finally that the learning from the commissioning of this service has influenced obviously this toolkit, but also the development of our local collaborative commissioning frameworks. Okay, thank you. I'll hand over to Jo now from Somerset. Thank you.
It's Naomi. Hi everyone, my name is Jo Coughlin and I'm the Senior Joint Commissioner of Children's and Adults for Somerset County Council. Next slide please, Amy. Council initially began work with what was the CCG back in 2019 to recommission the Community Equipment Service. So for those of you who are unfamiliar with that, the Community Equipment Service provides health and social care equipment to people to help them leave hospital safely and stay independent, resilient and mobile in their own homes. The equipment service is complex. In Somerset, it delivers more than 90,000 units of equipment each year. Then there's obviously the equipment collections, the decontamination of returned equipment, recycling, safety checks and maintenance visits and so on. And it supports over 1,000 prescribers, and that's both in and out of county. So there's a lot of people involved in some way or another, It's very busy, it's very pressured, and above all, it is a critical provision across the whole of the health, social care and educational services. So in the early stages of planning, commissioners from both organisations discussed the possibility of integrating community equipment with Health's wheelchair contract. The wheelchair service is much smaller in comparison to the equipment service. However, there are a lot of synergies with them. For one, the way that they operate, and for another, many people across Somerset rely on both of those services to meet their health and social care needs. So integrating them could have some advantages for everyone. For example, prescribers could be able to access just one IT system rather than the existing two, order off of just one catalogue with one provider. Our customers could have their equipment and wheelchair maintenance aligned so that they only had to experience one technician instead of multiple visits. And they should they need to, they could have contact with only one service support. It was a bit of a no-brainer. Additionally, it could also mean that we might benefit from savings or cost avoidances for only having one depot to fund, not to mention the potential for reduction in carbon emissions. I should point out, like others, we're not quite there yet. Sorry, Amy. I should point out that, like others, we designed and procured the service through the pandemic. But in addition to this challenge, the CCG transformed into an integrated care board, and Somerset authorities were, and still are, going through a local government reorganisation. But whilst all that made things harder for us at the time, it also highlighted the greater need for collaborating with each other. Next slide, please. So the 4 enablers. Despite the madness going on around us, our organisations were actively looking for ways to work more closely together. And the guide really does illustrate the essence of what makes effective collaboration. So we already had an appetite for collaboration, and our approach to do this was already moving forward. The community equipment already had a pooled budget, and so further collaboration wasn't such a big step. For co-production, we brought experts by experience onto our joint procurement board, which included operational staff, Health Watch and Somerset's Parent Carer Forum. So the power for making change was shared equally amongst us all. Because of their size and the way that they function, health and social care partners obviously take very different positions on what risks to their organisations look like. And there were some tough decisions, obviously, to make along the way. So to manage this, we held a joint risks, issues and actions log to reduce potential barriers to our progress. Effectively, we were all learning from each other. Neither side knew how the other operated, and so through the joint risks and actions, it meant that we were understanding what each side had to go through as we were going through it. And for creative allocation of resources, to ensure a balanced group dynamic, the community services manager from the CCG headed up the project. I was the lead commissioner representing adults and children from the council. And so for joining up the technicalities, we agreed that Somerset County Council would lead on the contract, but we would use the NHS Particulars contract template because it suited a much more complex service. Next slide, please. So to give you a bit more detail of what our collaborative working looked like in real life, we were sponsored by 2 great directors, one on each of the organisations, and they worked hard to open doors for the project group when we met barriers or we couldn't get past some of the logistical issues that we faced. I mentioned earlier our joint procurement board. As well as the users by experience, we had a broad spectrum of representatives from finance colleagues, one from each side, procurement, quality, as well as the various senior managers for a balanced view. Together, we created a joint community equipment and wheelchair service strategy, a document that we could share with market providers to help them understand our position. And then we held several virtual provider engagement events to run those ideas past them and take their feedback and shape the next stages. I also referred to our risk log in the last slide. We agreed early on that your risk is our risk, and where services, where the service was concerned, we made sure that we mirrored each other's corporate risk registers. The project lead and I went through all our respective governance processes together. It was an eye-opener for both of us. Between us, we generated the information for every document, and where we could, we presented them together. It was always going to be a challenge with so many voices on the project. I think by the time we reached the evaluation stage, we'd included 25 people for various different questions that we were asking the providers to respond to. And decision making across the, I think, 2 years it took us to do this was hard. However, the sponsoring directors regularly facilitated our procurement board meetings, and they were available for us on individual cases if we needed to. They were well placed to understand our challenges, and they were also well placed to enable us to get past them. They really did make a difference to our progress. I've already mentioned how we shared resources, but additionally, we've also created joint funded posts to work between the two organisations and have oversight on the contract's performance as it goes forward. So the community equipment and wheelchair service project involved a lot of people, as I was saying, and they all had direct or indirect interaction with the services. So it was really systems-focused collaboration. It was one that had allowed everyone to contribute to the service development. Next slide, please, Amy. So having recently experienced all of this, I can tell you it's all still very fresh in my mind, as I'm sure it is in Naomi's. So I thought I'd share a few of my own practical tips to collaborative working, as in my experience, it's often the case of you don't know what you don't know, and then you end up finding out the hard way. It's not an exhaustive list, it's just 8 of the basics to think about when collaboratively commissioning. As been mentioned earlier, relationship building is really important, and it needs to happen before getting stuck into the detail. It's much harder to deal with those details when you haven't bonded as a team yet and you don't understand how the other side thinks or operates. A big one that we found out at the beginning was do plan for technology challenges and data sharing obstacles. We're all using different systems and we all have different ways of working and different levels of IT skills. Preparation in this area can make a difference to the speed of the joint project's progress. Prepare your team for working with a diverse range of skills, experiences, cultures, languages and personalities. As Naomi said, language is a bit of a no-brainer, but inevitably it's the thing that trips us up first. Good communication skills and a high level of resilience makes a real difference to the quality of the project group. Consider the project group's capacity and conflicting workload. Easier said than done, I know, but successful projects involving more than one organisation requires a lot of focus and commitment from the individuals involved, and they can get caught in the crossfire of business as usual at the same time as trying to work on double the work. So it's definitely one to consider. Knowing what I know now, systems thinking, or at least systems awareness, is a critical skill to have in the project group, and understanding of how what the work that you're doing and every action that you take is going to have a ripple effect through the system. Knowing what I know now, I'm a systems thinking apprentice now, so I'm aware of these skills that need to happen, and I wish I'd known what I know now before going into the project. It would have made a significant difference to some of our initial work. Utilise the support of senior leaders and managers. They are, I can't tell you, a key to the opening doors and the success of the work. They really do make the situation much easier for everyone if we can all work at the same with the same gateposts. And finally, have those joint posts with agreed governance routes for continued collaboration. That really has made a difference. It's cemented our relationship with our health partners because we have someone who both sides trust, that will represent us all and ensure that we're all involved. So thank you for listening to me. I'm now going to hand you over to Jane.
Lovely. Thank you all very much. So we've heard this morning about the structure and the framework and the enablers in theory, and we've also had the opportunity to hear from two systems, two different journeys of what I was picking up. What resonated for me for Nottinghamshire, the way you were really strongly and powerfully referring to engaging with the survivors as part of your framework, part of that collaborative working, that not just the commissioners but who you were commissioning for, I thought, was really important. And Joe, in terms of Somerset, I loved your personal tips there, because I think they're the things that can often make a difference to whether something works, those bits of learning that then drop and think, why didn't we think of that sooner? And of course, on the Better Care Fund, we never have any of those moments, but thank you, that was great. So we've got a few questions in the chat. The first one I'm going to go to is for Philip and Amy, if that's okay. It's what's the IPC's reflections on the role of scrutiny and commissioning? Local authority, health overview and scrutiny committees have a role to play in scrutinising some NHS commissioning proposals. How can we ensure this happens collaboratively? What do you think?
Wow, big question, and obviously Amy and Jonathan do join in. I think what we've seen, not only in this work, in other work that we've done around the country around scrutiny, is that initial kind of agreement on what good looks like and what evidence is going to be useful in understanding that achievement towards that. So there is, people need to be on board as to want to be able to do that and to seek the evidence that's going to be a good indicator as to whether or not things are working. So I would say that actually where we have seen good arrangements around scrutiny is where that's been at work to actually say, yeah, we think that this is what we are looking for. We think that these are the outcomes we are looking for. Not just about process, but outcomes and impact. And we're going to work hard to find that information and that evidence. We might not have it hard to, but it's important, and everybody values that story. I think we say there's one version of the truth about what's going on here. I don't know if Amy or Jonathan want to add anything to that.
It's a comment, really. The important thing here is about the culture and that relationship, and about sharing that sense of shared outcome, shared risk, and things. So it's not so much about the structure; it's about that ability to collaborate, and through culture and leadership. Really important. One of the key enablers we talked about at the start of the session. That's the catalyst for good scrutiny. It's about having that shared vision and those shared outcomes, and being aware of those differences between organisations, but coming together. Amy, do you have anything else?
Yeah, I think I was going to say something very similar. I think it came up a lot in the guide when we spoke to people. It's when we develop processes for audit or scrutiny or whatever we're doing, it needs to be done together, so we have that shared agreement of what are we looking for, what does good look like, what do we both agree is our priority and the outcomes we're trying to achieve. And I think that's the important place, that these things aren't designed in isolation by one organisation to another, they're done together.
And looking at, sorry, can I just come in on that, and just looking at some of the other comments in the Q&A, I think we're looking for simple solutions to complex issue here. The policy, procedures, sections 75 or etc. are all going to be helpful, but they are going to be tools to facilitate, to enact some of that. But and we don't want to kind of keep going on about this relationship, but our experience of systems who work well in collaboration, whether it's at an operational level, and some of the examples that we've seen, or a strategic planning level, are about people wanting and making an effort to come together to solve those complex issues and complex policy directions that both health and social care have, etc., and go, yeah, we can make this work. And so it is about fundamentally leaders, either at a strategic level or an operational level, saying, we're going to work this out. We can work this out together. And I think both the examples that Naomi and Joe have brought to the table are really good illustrations of that, both at strategic level and also at a really good operational level as well.
Lovely, thank you for that. Another question we've got is about COVID funding. So some of the COVID funding arrangements put in place have reduced significantly. Any reflections from our panel and speakers on how collaborative commissioning can continue when the partnership balance and influencing platforms have changed? So just while you gather some thoughts on that, I would say, well, the Better Care Fund continues to be a collaborative commissioning arrangement, encouraging integration in everything it does, that unique position in sign off by the Health and Wellbeing Board with NHS and local authorities at the table. And that still continues to have significant funding streams in that. So I don't know, any of our panel would like to come in on that one?
I don't mind coming in briefly about this and see if any of my colleagues would. It's an interesting point, because actually I think one of the reasons people found collaboration easy is because money wasn't part of the problem. It wasn't the question. It wasn't, a challenge that you had to overcome, because the money was there, and we all agreed where it needed to go and to support each other. So, that's the reality of it right now, is how do we learn from now we're sort of maybe going back to a little bit where business as usual with some of the previous mechanisms that are in place to support sharing of resources, that we ensure ourselves that we don't just go back to square one again. We learn that, we saw the benefits from collaborative commissioning that were made easier because money maybe wasn't so much of a challenge for us to work through. But now realizing that, we're going a little bit back to that now. So what tools do we have, available to us to learn from that and take that forward? That would be all I would say on that. I don't know, Jonathan, if you wanted to add anything.
It's really, it's very clear from when we talk to systems about they value the legacy of that relationship that was established during COVID, between partners. And as Amy says, the money wasn't a problem or wasn't a barrier to those relationships. But the systems are really keen, working collaboratively to sustain and maintain those relationships going forward. And they've got some things in place already. It has some joint posts, but joint governance arrangements and things like that. So they've got some of the kind of building blocks to sustain that approach. And clearly, but those relationships were seen as being really, really important. And the legacy of those relationships was about how do you sustain that going forward. And clearly systems were really, really kind of keen to see that happen, and keep it going. So yeah, thank you.
Can I add a reflection too, Jane? That's okay.
Of course.
I mean, the what's being explored here is that in times of plenty, we do things well. That's not always necessarily the case. I mean, we can spend money badly as well. But actually, whether you have money or whether you don't have money, those principles are still ones that are worth pursuing. You still have to trust each other the way you spend the money. You have to spend it well. You still need good scrutiny arrangements in place. You still need good relationships with your provider. So all those elements are still important to pursue. Money makes things easier, but we can spend money badly. I'm sorry if that's upset a couple of people, but that's the reality. Our experience is good and bad spending of money.
Thank you for your thoughts on that. We did touch on the mention of Section 75 arrangements and also 256. Is there any other training or guidance out there that could be shared? I think it touches on what you were just saying, that money can be spent badly. You can have a legal document in place that says this will happen, but it can also mean it's not supporting the things that are the right services or the right commissioning. So any other thoughts on training or guidance out there around the legal guidance? What do people use, or what have you seen in use? Naomi, were you?
I was gonna probably just add a thought that I suppose some of my thinking starting to think, how can we use, I think it might be mentioned earlier around MOUs that support the project develop, so actually support you working together. So it doesn't always have to involve moving money around, but there's something around a system commitment to delivering shared outcomes that doesn't have. So I think if you start with the money, or we've got a contract ending, and how do we do it together? How do we review it together? It's more around, can we have MOUs that support that journey, so the system's got assurance that we're working together with using the money collectively. But and I think some maybe examples of Section 75s or partnership agreements where it's not all around a big pot of money. Actually, it's more, sometimes it's just around the commitment to the collaboration. Might be helpful for people.
And I think I just add there that the Better Care Fund, in terms of its narrative, is the story, and that is, whilst it's not labelled as an MOU, that is, you know, essential. That is the agreement. That is where commissioners are coming together to deliver a whole range of services to meet their population's needs. And the Section 75 is really just to cement that financially between the organisations to ensure that that money will be transferred. But as you say, that it's that story and that narrative that agrees how things are going to be spent. So thank you. I'll draw the Q&A to a close now. Thank you all very much for your time, and I'm going to hand back to Peter to close.
Very many thanks to our presenters today, and to all of you for attending. There's some really valuable reflections, I think, and some really key themes around what's possible. I mean, I've seen some other comments in the questions around some of the timing of this may, of course, have an impact, but we really hope that both today's session and the guide itself will be of use to systems. We want systems to find it helpful in a really practical way. And I think our two speakers, Naomi and Joe, have, in certainly my view, shown what can be possible, and interesting reference to the way that doors can be opened by leaders when the conditions for success are created, agreeing key roles and responsibilities between, for example, the CCG and a local authority. And that real willingness, that shared vision around helping to overcome logistical issues, I think are a real testament to what can be done, but clearly recognising that it's not easy. But hopefully, as I say, both today and the launch event and the guide will be of use to systems, irrespective of where you are as a local system in your integration journey. So thank you very much for joining, and we hope to see you at future events.